Effective March 27, 2020, the country was under a dusk to dawn curfew. 6 months later, the curfew has been extended by another 60 days. However, this time it is to begin at 11 p.m. and end at 4 a.m. Some of these restrictions that had previously been put in place have been eased, among them social gatherings, the sale of alcohol, as well as travel. Sights and sounds from the national COVID-19 pandemic indicate a clean sheet in terms of our scorecard and victory over COVID-19 in sight. However, with a second wave of infection across Europe and Asia, are we celebrating a little bit too early? On this episode of Metropole Debrief, we take stock of the hits and misses in our fight against COVID-19. Hello there and welcome to the show. My name is Ndero Oganga. 6 months since the first COVID-19 case was reported in the country on March 13th, a sense of normalcy is finally in sight. Speaking while closing the national COVID-19 conference Monday, President Uhuru Kenyatta announced a raft of de-escalation measures in light of the declining number of new COVID-19 cases. Among the relaxed measures is that on the sale of alcoholic beverages and operation of bars, which have been on an indefinite ban for slightly over 2 months now, can resume.
That the closing time for all bars and restaurants and eateries shall be 10 p.m. every day with effect from the 29th of September 2020, and their operations shall be with strict adherence to the applicable guidelines and protocols issued by the Ministry of Health. 5, that in line with the recommendations of the Interfaith Council, the permitted maximum size of religious gatherings is increased to 1/3 of its normal sitting capacity, but with strict adherence to all applicable guidelines and protocols issued by the Ministry of Health.
However, the nationwide dusk to dawn curfew has been extended for another 60 days.
That the nationwide curfew enforced throughout the territory of the Republic of Kenya is extended for a further 60 days. 2, that the commencement time for the nationwide curfew is varied from 9 p.m. to 11 p.m. Therefore, effective tomorrow, Tuesday, the 29th of September 2020, the nationwide dusk to dawn curfew will run from 11 o'clock at night to 4 o'clock in the morning. 3, that the prohibition against the operation of bars and the prohibition against the sale of alcoholic drinks and beverages by ordinary restaurants and eateries shall stand vacated with effect from the 29th of September 2020.
The resumption of learning activities will, however, have to wait longer as the stakeholders agree on how to resume schools while protecting learners against the COVID-19 virus.
The resumption of in-person learning must be predicated on strict adherence to the health protocols and guidelines as issued by the Ministry of Health. So therefore, I call upon the Cabinet Secretary for Education, once we have agreed on the how, he will thereafter immediately issue a calendar for the resumption of the 2020 academic year, if it is to be, or if it is going to be 2021.
The maximum number of participants in religious gatherings has also been raised to 1/3 of a whole seating capacity, while the maximum number of attendees to weddings and funerals has been doubled to 200. This, even as the number of COVID-19 fatalities hit 700 today, after 9 more patients succumbed to the virus on Monday. The total caseload in the country now stands at 38,168 cases, following an addition of 53 positive cases reported on Monday. Rosemary Kinyanjui for Metropole TV. And sounds from the COVID-19 National Conference, and that was President Uhuru Kenyatta's closing remarks. However, how did the conference go? Leaders from all arms of government and political divides congregated at the Kenyatta International Convention Center for the National COVID-19 Conference. The head of state in his national address made it clear that the aim of the conference is to review the national COVID-19 response in order to chart the future. Key on the agenda was deriving lessons from the pandemic and coming up with ways of plowing these lessons back into the system to ensure efficiency of service going forward. This is what he had to say.
Where were we efficient in our approaches to this pandemic? Can we say that our methods and our undertakings have delivered value for money? Are there lessons on how both human and financial resources could have been better applied? And how do we increase the value of our resources moving forward?
To this end, from the onset of the virus through the public and private well wishes, 2.6 billion shillings was raised to go into a COVID-19 relief kitty. Jane Karuku, who's the chairperson of the Kenya COVID-19 Emergency Response Fund, says the key priority for this kitty was health. Now, it is against this that 65 hospitals will within the next 18 months receive personal protective equipment. This is what Jen had to say.
We then decided to prioritize the spend, how we spend the money very quickly.
Yeah.
Health, PPE was the biggest challenge. In our committees, there was Ministry of Health representation in Dr. Kariuki. So we decided to work with the local manufacturers to do fit-for-purpose PPEs. And I can tell you, the doctors, even today in the morning, I asked them, they are confirming they are good. And Betty and other people have started exporting into the region. So that's good.
Are the doctors really good? Well, despite the availability of PPEs, the million-dollar question is, are they sufficient and are they of the right quality? Doctors say before we pat ourselves on the back for provision of PPEs, we must first pass the quality assurance test. Listen to Dr. Gaur Gudi.
The equipment that the hospitals have been getting are substandard gloves and face masks. I really want to emphasize this. If a health worker gets this COVID, they are likely to infect many more people because of the shortages that we have. They will go and see many more patients.
Well, you've had it from Dr. Gord there. However, while the milestones gains this far are clear, we are locally manufacturing our own PPE. So are our shortcomings in the fight against the virus. The pandemic has exposed the weak links of coordinated efforts between the national and county governments. At the onset of the pandemic in Kenya, there were no testing centers at county level, hence disease mapping proved to be a challenge. The pandemic has also shown how deep the revenue allocation and disbursement challenge runs in the country. This is what the chairperson of the Council of Governors had to say.
Speak now. Not all of this money has been spent because of the bureaucracy of moving from one financial year to the other financial year. Because there were supplementary budgets to be undertaken because it was towards the end of the year, and also there was a shortage of some goods on the market.
Okay.
So some of those goods had to be imported from overseas. You could not get ventilators, you could not get beds, they had to be imported. Okay. Some of them are just arriving now, but there was proper commitment because the county response committee had to come up with work plans and commitments. So this money was actually committed, although it has not been exhausted.
Okay.
Governor Oparanya there. Now, challenges aside, our national vices have also found a way of creeping up on us amid the pandemic. There are allegations that donations made by Jack Ma did not entirely reach the country and serve their purpose. Furthermore, KEMSA is currently under investigation for the alleged misuse of over $2 billion in aid and grant to fight COVID-19. However, like many other investigations, it might take years to get to the bottom of this matter. As such, Amani National Congress Party leader Musalia Mudavadi says we must draw the line.
Perhaps we needed a very specific approach to what are the fault lines, because it is clear that COVID is not over. So let me be a little bit self-provocative here. Who are the fault lines? Is it the politicians? Are we the fault line in the fight against COVID? Is it some of our institutions? Be it the parliament, be it the county assemblies? Are these the fault lines? Who has been at the forefront in breaching the rules in the fight against COVID? Is it us? Me being one of them? And if so, then what can we do so that we as the fault lines can be curbed so that Kenyan lives can be saved?
Ambitious remarks there by Musalia Mudavadi. How can we curb the fault lines? However, with previous graft allegations having gone down in history the same way, the Attorney General Paul Kihara seems to have taken the president up on the challenge of doing better moving forward. In his closing remarks, he says everyone implicated will be charged.
People will be prosecuted arising from what has happened at Kemsa. We as a people must learn. His Excellency earlier spoke about that unprecedented unity of purpose. Add to that effort. Add to that the most significant of them, purpose. It's got to be in our minds as Kenyans. Yeah. It's got to be in our hearts as Kenyans. Who does this? It is we leaders, we who are charged. Whether in the private sector, like my sister to my left, yeah, or whether in the public domain. And what happens when these people come to court? We start talking about our tribe, our people, yeah, being finished. I hope to God we can desist from that, okay, and allow the law to take its course, to its logical conclusion.
Okay. Allow the law to take its course to its logical conclusion. 6 months into the COVID-19 pandemic, we have seen the good, doctors sacrificing their well-being and giving their best in catering to the health needs of the country. Local production of PPE has been some of the good that we've seen. We have also seen the bad, substandard PPE for doctors, no pay for doctors, delay in welfare, and wrangles between the national and county governments. We have also seen the worst in form of alleged thuggery amid a global pandemic, death, and even loss of livelihoods. After the break, we unpack the COVID-19 National Conference, the hits and the misses. We'll see you shortly.